changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare Certified Agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor Show, living a longer and healthier life. Tonight we're going to talk for the first half hour about the foot and ankle with a foot and ankle surgeon who's local right here to Boca Raton, where we're coming from you live in the studio. Once again, as you heard probably in the commercial, if you have any questions about home health care, check out allcountyhealthcare.com. I'll give out some of their information later in the show, but great thing about them is they sponsor the show, so immediately we're on their Facebook Live feed, and you can always go back there at All County Healthcare INC on Facebook to check out a show maybe you missed, or if you want to go back and watch a little bit about one of the physicians said on the program, you can always go there, or allcountyhealthcare.com has a whole video library of all the shows, so great for them to sponsor the show so we can bring you the latest in healthcare. And I just shared it on my feed because that's what I do. Dr. Woods, I'm so glad to have you in the studio. You're a foot and ankle surgeon right here in Boca Raton. I know you've been on this radio program before, but the listeners probably in video don't recognize you from, you weren't on my show, you were on another show.
Definitely.
So thank you for coming back aboard.
No problem.
I really appreciate it.
No problem.
So you're on staff locally at West Boca Medical Center.
Correct.
And we're going to talk a little bit about the other hospitals you're on staff at, but I'm familiar with you there. And you're a foot and ankle surgeon. How long have you been a foot and ankle surgeon in this area?
So I've been here now going on 5 years over at West Boca Medical Center.
Okay. Nice. 5 years. Wow. And you're locally with, is it Gelb Orthopedic Institute?
Gelb Sports Medicine.
Gelb Sports Medicine.
Yeah.
Okay. So that is where your practice is located.
Correct.
Nice, and that's in Boca Raton too.
Yes.
Okay, fantastic. Now I wanted to have you on the program because I'm sure you get a lot of questions about sports.
Oh, definitely.
And there's so many foot and ankle injuries in sports, and one of them, obviously, basketball's in full swing right now, and the Clippers, Milos, and I'm gonna get this wrong. Teodosic.
Yes.
I'm not going to get that right, no matter how harsh.
I don't think the announcers get it right.
No. It's definitely Croatian. I know that.
Exactly.
They play great basketball.
Yes.
No, Serbian it said. I was close. But he injured, and the way they write it in the news is the injured his plantar fascia.
Yes.
Did I get that right?
Yeah, plantar fascia. So it's always kind of a little difficult to explain to patients what the plantar fascia is because everyone knows tendon and ligaments. So what the plantar fascia is, an actual band of tissue that runs on the bottom of the foot. And for most of the community, what ends up happening, they get plantar fasciitis. But what he actually did was tear his plantar fascia. So that band that kind of, when you're running or walking, kind of withstands your arch from collapsing, he actually tore that. So a lot of times when you tear that, that's a good 6 to 8 weeks of being out to let that heal. And most of the time they're in a boot to try and let that heal.
Now, can that also be stretched too? Because I feel like sometimes people have it. I feel like it's annoying and painful, but maybe it's just a stretch. Like weekend warriors would have more of a stretch.
Exactly. So even myself. So when I'm running, usually I have to run like on a Monday and a Wednesday. If I do back to back, the next morning I'm walking like Frankenstein. because what happens with the plantar fascia, I like to make things very simple and in layman's term. So if you had a rubber band that is, you've brand new, it's really elastic. As time goes on, that rubber band actually starts to stretch, loses elasticity, and you get those little cracks in it because it's worn. Same thing happens to the plantar fascia. You get these little microscopic tears in the plantar fascia and inflammation. So now when you go to sleep, the way we sleep, we never sleep with our foot up, with our toes up, what we call dorsiflexion. We kind of sleep more in a plantar flexion with our foot kind of hanging down. Now you take that first step, and it rips apart and feels like someone's sticking a knife in there. So the best way to kind of do that, like you said, is stretching, but not only stretching, sometimes you can never walk barefoot. So I always kind of recommend getting a nice little sandal with a heel in it. One of the places is called, one of the brands is called Vionics, because they have a nice little heel cushion. You can also put a heel pad in the shoes, and then stretching is a big thing for that too. Yep.
Is that a simple stretch where we would grab our toes when we're sitting down on a flat surface? You
can grab your toes and grab it and kind of pull back on a flat surface. Best stretch for you, kill two birds with one stone. Get a bottle of water, throw it in the freezer. Okay. When you throw it in the freezer, you come home while you're sitting down. You can watch your favorite shows at 7 or 8, and you put it on the bottom of your foot and you roll it back and forth in your arch to try and stretch that fascia, and you get the icing and you get the stretching at the same time. So then you can watch the rest of your shows.
Nice. Yeah. Where else would you get that info, South Florida, from a foot and ankle surgeon right here? And you're getting it right here on the You and Your Doctor show. That's great. Now, with a torn one like this basketball player had, I'm kind of looking at the article. I'm just going to paraphrase it. When he stepped on the foot of the Phoenix Suns player is when it happened. So it must have been a overstretch there and then a snap.
Yes.
Right all at once.
Yeah. And usually what you'll see is that fascia will kind of just really tear. So it's not like a plantar fasciitis where it's a micro tear, but the only thing you can really do for that is just resting. So it's not really a surgical procedure to let the plantar fascia heal. It's more of a boot, letting it kind of heal on its own over a 6-week period.
And you do that type of treatment?
Yeah, so I do that type of treatment, and even with plantar fasciitis, the one thing about plantar fasciitis, I always tell people when they come in my office, there's good news, there's bad news. Good news, it goes away. Bad news, it goes away when it wants to kind of go away sometimes. But things that we can do to help you, besides the heel pads, the not walking barefoot, even doing physical therapy, is what we were talking about earlier, like PRP and stem cell. So as of recently, PRP has been going on for a while now, but for plantar fascia in the foot and ankle world, we're looking more into it to try and help with that inflammation and try and help with the pain, because there's a lot of treatment option for plantar fascia that doesn't always work.
Now, my listeners and viewers will definitely, we've done our homework on PRP. We know it's platelet-rich plasma injections. We've had a few doctors talk about it.
Yes.
But I've never heard about using it in the foot or ankle, so that's great news.
Yeah, we definitely, you can use it for plantar fascia. You can use it for Achilles tendonitis. You can, pretty much any kind of tendonitis in the ankle. So your peroneal tendons, your posterior tibial tendon, use it for all of those.
So take us a little through the process, because the common public, I don't know if we understand it. We know that it's blood taken out of our own body, it's our own blood, and go from there, because it's a little confusing after that.
Yeah, it's actually pretty simple. So what we actually do for the PRP, or platelet-rich plasma, is that same way you go to your doctor's office and get your blood drawn to get your regular blood work, like your H&H and your chem panels, it's sort of that same process. So we take a tube, we draw the blood out. Then from there, it's actually put in a centrifuge. And when it goes into centrifuge, it kind of separates the layer, in a sense, oil and vinegar kind of thing. The top layer is the platelets, or the plasma layer, and it has growth factors in there. The actual syringe that is used for this is actually pretty cool, because it's a syringe within a syringe. So the top syringe, you just suck up the plasma layer, unscrew it, and your PRP is ready to go. So in all, really, the only thing that's a little time consuming is the spinning, but it's a 10-minute procedure, because you have to wait for it to spin down and then you inject it. Most of the times, the most common sort of thing that occurs after that. You may have some a little bit of pain after the injection, but it works really good for inflammation, and it's just an option that you can use if you don't want to do surgery for something. In addition to that, unlike cortisone, it doesn't cause any breakdown of the soft tissue, so that's a benefit of it too.
And done right in the office and can walk right out of the office. Same
Correct.
day. Same visit.
Same visit. Yeah.
Wow. We're here with Dr. Clive Woods. He's a foot and ankle surgeon at Gelb Sports Medicine Orthopedic Center. Their number's 561-558-8898. They're actually located right here in Boca Raton on the campus of West Boca Medical Center, 9980 Central Park Boulevard North, Suite 222, so 222 in Boca Raton. It's just near Palmetto Park and 441 right there on the campus. And I'll give out the info a couple more times during the broadcast. Dr. Woods, one of the things I also want to talk to you about is, play ball, baseball season is here.
Yeah.
And, our producer, Freddie, his favorite team is the New York Yankees.
Oh, yeah.
So, we have their first baseman's already out.
Yeah.
So he had, he's out 6 to 8 weeks.
Yeah.
So, he already underwent surgery for injury on his right ankle. And I know you're not his physician. I know you deal with a lot of athletes, but, he actually had soreness in his foot during batting practice, but it turned out, it said it was a foot inflammation, but then it turned out to be a right ankle surgery. So without knowing too much about the actual injury, when is ankle surgery necessary, and when is it something that can be managed in a sports medicine standpoint?
Yeah, so usually the way we look at ankle fractures is, or just in a sense, if you have any kind of ankle injury, mostly for fractures is based on stability. So we always want our joint to be congruent. And what I mean by that is when the joint is well aligned, it leads to less wear of the joint. So same way every 6,000 miles you got to balance and align your tires. Same thing with the ankle joint. If you break your ankle, it can heal, but if it's out of alignment, it's going to wear down. So usually those ankle fractures that are unstable, those are the ones that we fix. And the ones that are a little bit more stable, the joints well aligned, those we can let heal on their own, whether it's boots, cast, or whatever it may be.
I have an update on that from Dan Gartland of Sports Illustrated.
Yes.
It was actually a surgery was needed to remove a broken bone spur. So they call that an ankle surgery. Is that that's an ankle surgery?
Yeah, they depend if the spur is in that ankle joint, they can definitely do that. And usually, most of the times, you can remove that actually minimally invasive using ankle arthroscopy. So small incisions. You go in there. If it's a bone spur that's there, you go in there with like a little burr, and we're talking about incisions that are like a centimeter or so. You go in there and you shave that down, and then you actually can recover a lot quicker because it's not a large incision. We're starting therapy right away to get your motion, and then after that, get your strength back, get you back on the field.
Yeah, and it said he suffered the injury when he fouled a ball off his foot.
Oh,
ouch.
Yeah, that hurts.
Don't they normally wear like hard shoes or hard cleats, almost like a steel toe top?
Sometimes they do. It really depends. I mean, there are players that, for example, like Frank Gore, who just
signed with the Dolphins.
Signed with the Dolphins. Huh. He's one person that, I'm surprised with his knees. He doesn't even wear pads around his knees as a running back. And that's like prime position to get popped by a linebacker.
I used to hate that.
Some people just aren't comfortable with wearing certain equipment.
The way that helmet and those pads go to the bone without wearing pads, I played, and I hated that. Those are bone bruises.
Oh, yeah, deep bone bruises, too.
We got to make sure Freddie's team, the New York Yankees, get some steel-toe shoes because they have a big series coming up with the Red Sox. And as I was looking here on Sports Illustrated, the Yankees and Red Sox are actually playing in London in 2019.
Oh, that'd be pretty cool.
Crazy.
Yeah.
I think that may be cricket area. I know. Yeah. Different areas of the British Empire was cricket area. I know, obviously India is a huge cricket.
Well, the funniest thing is, a lot of people don't know this about me. One of the first sports that I played from age 2 to 15 was cricket.
Really?
Yes.
Were you at that cricket down south that I hear about?
Yeah, so my dad...
Where is that, in Broward County?
Well, usually what ends up happening, so my dad is from the West Indies, St. Kitts, and one of the sports that he plays is cricket. So every Sunday, there's a cricket match at local fields. So from the age, like I have pictures of with a cricket bat. But then after I grew up, it's one of those things, in Miami, not many people are playing cricket.
Yeah, but they built some kind of cricket stadium in, I want to say Broward County.
Yeah, I think, because someone was telling me about that, yeah.
Well, hold that cricket story. We'll be right back. We're going to take a quick commercial break with Dr. Clive Woods on the Foot and Ankle Surgery Show here on the You and Your Doctor Network.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And we're back with Dr. Clive Woods, foot and ankle surgeon. If you have any questions, we have them at least for another 10 to 15 minutes, 1-888-565-1470, or ask him on Facebook Live if it's appropriate. I'll try to get it in front of the doctor. So Dr. Woods is an orthopedic surgeon, board certified, fellowship trained in foot and ankle surgery. Wow, that's that education and training is amazing to concentrate in just that area for the fellowship. Yeah. I just want to mention where you're on staff at. Gelb Sports Medicine Orthopedic Center in Boca Raton, West Boca Medical Center, Northwest Medical Center. Heard of it? I want to say it's in Broward County.
Yeah, this is in Margate.
Margate, okay.
Yeah, probably about 10 minutes on 441 south of West Boca Medical Center.
Okay, because we broadcast obviously into Broward County as well. Okay. Park Creek Surgery Center. Yeah. Haven't heard there.
So Park Creek Surgery Center is an independent private surgery center. It's between Holmberg and Hillsborough on 441.
Nice. Oh, that's right around the corner.
Yes.
And Coral Springs Medical Center, which is part of the Broward Health Group.
Correct.
Yeah. Congratulations to them. They have a new CEO, Jared Smith, who I was lucky to work a few years with in the healthcare industry, in the PR world. But he's not in PR, but I'm just saying that's how I met him.
Okay.
I just want to give out a couple of your areas of interest, and maybe we could do talk a little bit about them. We talked about cortisone. We didn't talk about cortisone, but you do that. Yeah. We talked about PRP, which is platelet-rich plasma injections and stem cell injections.
Correct.
You also now this is something that affect the baby boomers and other ages: bunion and hammer toe correction.
Correct. Yes.
So bunions, I think, can be, correct me if I'm wrong, they can not only be genetic, but they can be caused as well, meaning like if you wear the wrong shoe?
Correct. So a lot of times the two common causes are genetics, and also if you wear shoes that are the toe portion, if it's a little narrow there, that can definitely do that. So all the stiletto wearing, that catches up with you.
I only wear stilettos once a year. And that's the stiletto race in Delray Beach.
Oh, yeah, that is true.
They do it for charity, and I've actually ran in it once. I don't do it every year, though. Okay. I can't ice skate because I've always had ankle problems. I messed up my ankles playing football, and I always turn them in ice skating. and I can't wear stilettos because I turn my ankles when I'm running up the stairs.
You might have some ankle instability. That's one of the things. That's also something that I do too, because a lot of times people get ankle sprains, and 85% of the times ankle sprains get better on their own. But if you have chronic instability where you're walking and you're turning your ankle, there are things that we can do to fix that. And as far as getting you back to your sports a lot quicker now, because technology has kind of surpassed where it was literally 5 years ago.
Well, let me ask you, because it's obviously football injury, and I do have to come visit you, because here's what's happened. Since I was 19 and kind of torn pretty bad. I'll be really quick with the story because I want to get a lot more info out. But I was pretty much running up to a pile. I hadn't made the tackle, and the whistle hadn't blown, and an offensive lineman took me out. And I twisted my ankle like this on the left side. So after, I was out for a good while, and I was on crutches, didn't have to have surgery. But when I'm walking sometimes, the ankle will just turn. Even if I'm like on a flat surface. Or the worst is when I'm on my walkway going home, it goes to grass, and if the landscape has grown out a little bit, I get on that edge, and so that feeling, I hate that.
So what that is ankle instability.
I have it.
I always tell people there's only really two ways you can get rid of ankle instability. There's no way that is non-surgical to get the ligaments, if it's chronic, to get the ligaments to heal or tighten up. The way we try and get that better is by strengthening the muscles around it. So that's one way that is conservative, non-surgical. But if it continues to happen even with therapy, then that's something that we do surgery on. And what we usually do is, depending on the quality of the ligaments, go in there, tighten them up. In addition to that, the thing that has kind of gotten a lot of my patients back quickly, where they're walking in like 3 to 4 weeks, is something called an internal brace. So everyone wears a brace on the outside of the ankle. They call it the internal brace because it's a very powerful suture that goes on top of the repair, and it kind of acts as a check rein, so that if they're walking, it's not going to stretch out, and it kind of, in a sense, protects the repair until it's fully healed.
That's good to know, because one of the things, we were talking a little bit about golf before. I love walking golf courses in South Florida, especially in the summer. I was born in the summer, and that doesn't bother me. But when it gets a little hilly, or I always, in the golf shoes, like, I'm meant to wear high tops. And no golf shoes are high tops. And those stupid golf shoes, they always turn.
So
and it's always inside with me. Never the other way.
Well, the couple of things that I would tell you is that they do make some that are high tops. So one popular golfer is Ricky Fowler. Puma actually have a high top version of a golf shoe, and then the other ones, which are a lot more expensive and hard to get in contact with, a pair of, is Jordan actually makes golf shoes too. He takes his old basketball shoes and make them golf shoes.
Two of my neighbors up in Jupiter, I'm from Jupiter originally, they both live up there. And you play golf?
Oh yeah, definitely.
Nice.
I love golf.
So you're originally from Miami?
Yes.
Okay.
Born and raised.
Nice. And came up this way. Where did you go to medical school? And I guess take us through medical school, and is it residency after that, and then the fellowship?
So I did my medical school at Meharry Medical College, which is in Nashville, Tennessee. So I was there for 4 years, and then from there I came back down to University of Miami Jackson Memorial Hospital. So I did my orthopedic residency there for 5 years, and then after that I did a foot and ankle fellowship in Tampa, and then that was under Dr. Roy Sanders, Arthur Walling, and Michael Clare, who kind of are nationally known, and some of them internationally known.
Is that Tampa General then?
Yeah, so it's separate from Tampa General, but he is Dr. Sanders is the chief of orthopedics for Tampa General.
And that was your fellowship?
Correct.
Wow, and we know Jackson, we've had a lot of doctors on this show. What a great teaching hospital. Huge hospital, right? Someone told me 1,300 beds? That many?
Yeah, the intern year is not necessarily, it's taking care of patients, but learning your way around the hospital, because it's a big hospital.
I have a tough time at Delray Medical Center in West Boca, so I would get lost in there, huh?
Yes.
Probably
like 4 or 5 times the size of those.
Yeah, they'd have an alert out on me. The big guy's lost in the middle. So, let me ask you, from those experiences now, do you ever get called on for trauma, like foot trauma? Like, I guess, because you have on your areas of interest, like, total ankle replacement. Can, like, stuff happen, like, in car crashes or just, like, really bad falls?
So what can happen is the ankle replacements that usually occurs in, one, it can be post-traumatic. So if someone had a really bad ankle fracture, and like we were talking about earlier. Yeah,
it's just that foot or ankle fractures.
Yeah, and if it's not, in a sense, treated, or they say non-surgical, and it's all out of alignment, it can wear it down. And what we do for that is ankle replacement, so you can maintain your motion. The other things that ankle replacements can be used for is just general arthritis, where if someone's a laborer and they're doing a lot of walking, or athlete doing a lot of running, that's usually what, or even rheumatoid arthritis, things like that is what we use.
Yeah, I saw another one of your areas of interest is arthritis, the foot and ankle.
Yes.
And I've had these shoes on all day, but I got to ask you. Look at this, Dr. Woods. Do you see that?
Yeah, you can see how you're wearing it down. So
do you see how I walk?
Yeah,
isn't that something?
Yeah,
I have an issue there, don't I? On both sides.
Yeah, because what it looks like is sometimes you can pronate, like kind of push in, and that's usually, we call that a little bit of a flat foot deformity, or just when you walk, the foot just kind of turns in. They actually make shoes for that. So when I actually pronate on my left, so when I run, I usually get a shoe with what we call a medial heel post. That's a little bit thicker, so that's the back of the shoe. So now you can't turn in as much.
So you can help with this. I need to come see you.
Yeah.
Do you take most major insurances?
Yeah, so we take most major insurance.
Nice.
You know, Aetna, Blue Cross, Humana, pretty much everything.
I gotta come see you because last year I fractured metatarsal playing basketball. I'm always doing things to my feet.
I get a lot of those, a lot of fractured metatarsal.
So that's like I always describe it with the hand, but you'll obviously do a better job. You're a foot and ankle surgeon, but I feel like I fractured that one.
Yeah. So with the metatarsal, and the hands are similar a little bit to the foot. So this portion here, that we're moving our fingers, we consider that the phalanx, and the metacarpals in the hand is equivalent to metatarsals, which is sort of like an extension of those that they go down. And a lot of people can fracture that. Even like when you say you turn your ankle, a lot of people get fifth metatarsal fractures from doing that when they kind of twist too. So it depends on where the energy is kind of transferred to.
And we can come see you for toe fractures, so we're like cruising around the house and we catch the side of the furniture. Yeah,
there's a lot of screaming and bad words after you do that.
Yeah, the toes hurt bad.
Yeah, definitely.
And then even things with like problems with the nails and whatnot, does it always go to that, or does that go to podiatrist?
Yeah, that's more podiatrist. So I usually do more of the fracture reconstruction sports stuff. And then the nail care and stuff like that, usually the podiatrists take care. So wound care, nail care, stuff that is more frequently that has to be done.
So that diabetic, that splits
foot ulcers.
But obviously, you and your team can refer to great podiatrists in the area. Awesome, man. I love having you on the show because we've covered so much info, and we're going to talk a little bit more. I wanted to ask you, do you have prior experience working with my favorite team, the Miami Marlins? Yeah,
so that was under Dr. Lee Kaplan. So when I was down at University of Miami, Dr. Lee Kaplan is the sports medicine doctor.
I know the name.
Yeah, University of Miami, and in addition to that, the Florida Marlins, or Miami Marlins is what we should say. And so with him, I got to take care of some of the players.
So Dr. Woods, undergrad, Florida State University.
Yes.
So you're Seminole.
Yes.
You're from Miami.
Yeah, I started off as a Cane and then went away and became a Knoll, and then, kind of became a little bit back a Cane.
I started out as a Knoll.
Yeah.
And became a Cane.
Oh, wow.
I actually saw Gino Torretta play a game up there in Tallahassee.
Oh, that's pretty cool.
I want to say like 91, because he won the Heisman in 92, right?
Yes, correct.
So, they lost.
Yeah.
But I was a Knoll fan then, and I had some friends take me to the game, and then slowly started going down to University of Miami games. It was a little easier to get to from Jupiter to Miami than Tallahassee. Yeah. But I was a big Deion Sanders fan, so
I love Deion.
and I got to play at his high school in the state playoffs. He played at North Fort Myers, and I played against Javon Curse, the freak in that game. He was playing strong safety.
Yes.
Ouch.
Yeah.
So that's my blast from the past. We go on and on about that.
Yeah.
So we're here with Dr. Clive Woods, board certified and fellowship trained in foot and ankle surgery, with locally here at 9980 Central Park Boulevard North, Suite 222. Easy to get in and out of. A lot of parking over there. It's on the campus of West Boca Medical Center. GelbMD.com. On Facebook, they have their own page, Facebook.com/Boca Foot and Ankle, or Boca Foot Ankle Doc. I'm sorry. But then also Dr. Woods has his own Facebook page as well, and it's just Clive Woods, MD.
Yep.
So you can get a little more information. I know you just posted, you had a great talk over there at West Boca Medical Center on foot pain and neuropathy remedies. Did I get that? Neuropathy?
Yeah, so that was over at Mount Sinai, which is behind, a little closer to West Boca, but it's behind that area there. So talking to the community about what they can do about neuropathy and different types of foot pain, whether it's bunions, hammer toes, arthritis, just various ailments.
Nice. And on your page, you got to look into the office, the staff there. That's great.
Yes.
A lot of great photos, and man, they really like you. 41 likes, 5 shares, 6 comments. Those are good Facebook numbers.
Exactly. Yeah.
And a 5.0 review as well on your Facebook page. So that's great. I'm sure you do well and on all those doctor reviews that are going on everywhere.
Yeah.
So I'm really glad to have you on the show. I wanted to ask you, and I don't know if I'm correct in saying this, so you can help me. Can foot and ankle orthopedic surgeons treat above the foot and ankle?
Oh, yes. So, in a sense, for the orthopedic surgeon that is fellowship trained in foot and ankle, for example, I treat wrist fractures, forearm fractures, elbow fractures, hip fractures, because the first 5 years of my training is not only foot and ankle, so I'm not limited just to foot and ankle. So 5 years at Jackson, we were dealing femur fracture, hip fractures, wrist fracture, anything that's broken besides a pelvis and a back, I can fix.
We have a Facebook question.
Yes.
This is from Rachel Herda. She's direct primary care of Boca Raton.
Okay.
She's been on the show a few times. She's a primary care physician.
Yes.
She asked that I have you ask you about, is it Charcot foot?
Charcot arthropathy.
Is that French?
So,
I messed that up.
So what Charcot arthropathy is that this is mostly in a diabetic patient, really any kind of neurogenic kind of complication. So meaning that they get these micro fractures that, because their sensation is not as good, for example, if I had a little small fracture, or if I'm doing too much, I would feel that pain and I wouldn't walk on it. As for someone that's diabetic or has any kind of neuropathic pain, they're walking on these and causing fractures and collapse of the foot. So they get these various deformities of the foot, which then when they get the deformities, they can get pressure ulcers there. So a lot of the times there are a couple things that we may have to do for that. There's total contact casting, which kind of allows the ulcers to heal and let the Charcot, in a sense, calm down. In addition to that, we do Charcot reconstruction. So that's mostly you see it more in your diabetic and your neurogenic patients.
So that's probably what she sees it more of a primary care standpoint. Well, that's great that we have people asking from Facebook and a colleague in the medical community. I know we're getting shared. We got 9 shares on Facebook. Isn't it amazing nowadays? Like, we're getting so many interest off of Facebook Live. And I told you that my cousin told me she was listening in London.
Oh, wow.
I was like, what time is it? She's like, 1 a.m.?
That's what it's pretty late there.
Yeah. And Dr. Bela Kovacs, who's been on a few times, he's an internist at Florida Medical Center.
Yes.
His son watches when he's on in London, because there's an iHeartRadio app. So nowadays, I think it's amazing technology. So she got another question.
Yes.
Is there a percentage amount of the risk for re-injury after a twisted ankle?
So there is, well, not necessarily a exact number, because it really depends on how they rehab it. So a lot of times when people come to my office for ankle sprains, I'm a little bit more aggressive. So what do I mean by that? Sometimes when people have ankle sprains, they go to the ER, they put it in an ACE wrap and give them crutches and say it'll be better. That doesn't always happen, so I usually see the people that it doesn't get better. So a lot of the times, if it's treated correctly, first I start with what we call a cam walker boot immobilization to allow things to calm down. Then after that, as they start to feel better, I get them into physical therapy where they're doing some gentle stretching. But as far as immobilization, I would use things like a lace-up brace to support the ankle. And then after they're really getting their strength back, then they do TheraBand strengthening and getting back to the activities. But really the risk of reoccurrence depends on how the actual ligament has healed, if it was treated appropriately, if they went back to sports too early. Of course, that can get re-injured. So I can tell you for sure, I've had people where, they didn't come in till 2 or 3 weeks and it's like, oh, my ankle twisted. And then 2 weeks later, I was doing something that twisted again. Where it becomes a problem is if, over a year, they're like, oh, I've twisted my ankle like 4 or 5 times. That's when we're going into the chronic ankle instability where we have to figure out what to do so that, in a sense, they don't get arthritis in the future.
Yeah. Rachel, I hope that helped you out. I'm definitely going to give you a shout out. That's Rachel Herda, ARNP with Direct Primary Care Boca Raton. I know it's right over by Boca Raton Regional Hospital, actually right across the street. So check them out for your primary care needs. And she's been on this show twice, and I really appreciate her watching. It feels so good because I have a cardiologist who watches this show. Yeah. And I know because I see him on. Okay. And he tells me too. Nice. But he hasn't asked me a question, but that's great that we're really getting, the word out in the latest health. I mean, we have amazing doctors here in South Florida. I say this all the time. Yes. We are so lucky. Yeah. And definitely to have someone with your expertise as well. Tell me a little bit about Gelb Orthopedic, because I know Dr. Gelb, you've been with him for a few years. Yeah, so I've been there 5 years. So not only do we treat fractures and foot and ankle, but Dr. Gelb is a sports medicine doctor. So, your ACLs, your meniscus, your labral injuries in your shoulders, rotator cuffs, biceps tendon rupture. I mean, we do pretty much everything there. So we got you covered from head to toe. Perfect. Well, I want to thank you again for being on the show. Let me give out your info one more time. It's Dr. Clive Woods, foot and ankle surgeon, but he does it all. He just told us. He's trained in everything. So, and Dr. Gelb does a lot as well there. It's Gelb Sports Medicine Orthopedic Center, 561-558-8898. Check them out at gelbmd.com. Thank you again for being grateful with your time. No problem. I know we passed in your building, and I was really appreciative of you wanting to come on my show because you've been on this network before, and you're always welcome. Thanks. And if you just want to sit here and tell us about what's going on in the world of sports with Jones surgery, I know we didn't get to talk about Jones surgery tonight, but I'm sure someone's going to have it soon. Oh, yeah, definitely. So you're always welcome on the show. Okay. Thank you again. We'll be right back on the You and Your Doctor show with Lou Biasi, Vice President of All County Healthcare.
Hi, I'm Deanna Barron, RN, with All County Healthcare. You know how I know that I've done a good job? We say goodbye. After you understand the medications you take, once you know that gaining 2 pounds in a day means you should call the doctor, when your wound is healed, when you can use your nebulizer all by yourself, when the goals that you and your All County Healthcare team of nurses, therapists, and aides established are met. We say goodbye. Very nice to meet you, and I hope I never see you again. And I mean that in the nicest way possible.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 20099096. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And we're back. And the second half of the program is going to be living a longer and healthier life. And we have, as promised, Lou Biasi, Vice President of All County Healthcare, with us today. Lou, you're looking great. You losing weight? What's going on?
Well, David, I have to lose weight because my knees are hurting me so bad. As you grow older, you get these knee pains, you get torn meniscus, and the doctor says you got to lose weight. So I'm trying, and I'm eating your brownies. I'm eating your diet brownies all the time.
Paleo brownie bites.
David's way taking the brownie bites. I'm eating those brownie bites of yours, David. Thank you.
Love Katie cakes. I'll give them a shout out.
But I want to thank you for having me on, and we're going to talk about home health care. What is home health care? Who's entitled to home health care? How do you get home health care? And why you should have home health care. One of the things that we do at All County, we've been in business for 25 years. And what we basically do, we do the respite custodial through a sister agency, and we do the clinical. There are two differences. One is basically all clinical, where you send the nurses in, the PTs, the OTs, all the specialty services that you have. The other is respite and custodial care, where a patient might just need some home health aid in there to help her with a baby, with her ADLs, which is called activity for daily living. Now, as you grow older, you have a choice. I always say, you're once an adult, you're twice a child. You come in as a baby, and if you live long enough, you go out as a baby. And I'm experiencing that right now. And Maddie even had to help me up because, my knees are getting hurting. I just had stem cell replacement. Mm-hmm. Hopefully that helps, right? There are all kinds of new things are coming on. And that's what you should know about. That's why we have this show. What's new out there? What's new for the seniors? The seniors, little by little, a lot of stuff is being taken away from them. They have a lot of these physicians now are starting with these ACOs, these MSOs, a lot of managed care is coming in. And poor seniors, they really don't know what they have. You say, well, do you have Medicare? Yeah. But then you find out they have managed care because they have what they call Medicare Advantage. The Medicare Advantage plan it's a great terminology, Medicare Advantage. Mm-hmm. Well, it's an advantage as long as you don't need it. You need care. But once you need care, it's a disadvantage. So when the government gave you something back, when President Kennedy and Johnson signed this bill into the Social Security Reform Act, where they give you a Medicare at 65, if you're totally disabled, you're entitled to Medicare. You paid for it all your life. And my answer is stay on. If you're listening to this program and somebody's trying to say you something different, say, listen, I want to stay on straight Medicare. I paid for it all my life. That's where the government spends 99 cents in every dollar in medicine. Mm-hmm. So the answer is, if you got something that the government is giving you that you're paying for, and when you need care, the care is going to be there. If you have Medicare, Part A and Part B, any hospital in the country will take it. Any hospital in the country will take Medicare. That means if you're in Texas, you go to MD Anderson for cancer. If you want to go to Cleveland Clinic, you can go to Cleveland Clinic. When you're on an HMO and a Medicare Advantage plan, you don't know if they're going to take your plan or not. So the answer is, if you got something that universally it's accepted by every doctor, every hospital, that's what you want to stay on. And when you're on Medicare, one of the provisions was that when you are 65 or you're totally disabled, Medicare says you're allowed home health care. Meaning if you have surgery, a hip surgery, well, Medicare will kick in and they'll send a PT, an OT, a nurse to your home. That means as faster you get out of the hospital, the better you are. You don't want to stay in the hospital too long because there's a lot of, as people heard about these, a lot of MRSA going around.
Infections.
A lot of infectious disease going around.
Well, is it true the hospital wants you out as well?
They want you out.
Yeah, because they have a certain criteria that they have to hit.
Right. So the fact of it is, if you have a hip replacement, a knee replacement, or open heart surgery, you want to get home as fast as possible to avoid this idea of MRSA or infections. Once you get home, you're in your own environment. I always feel if you're home, I think you're going to heal better. Okay? Mm-hmm. And at that particular time, whatever company you select, one of the things is, if you take home care, Home care is your choice, not the doctor's choice. It's your choice. You can choose any home care agency you want. And I'm happy to say All County Healthcare has a 4.5-star rating with Medicare and a 4.5-star rating with ACA. We worked hard to get that 4.5-star rating. And if you heard some of our nurses on our commercials, and listen, me being a senior, one of the things I tell my nurses, if the patient needs 15 visits, you give them 15. If they need 50, you give them 50. Whatever they basically need for visits, you give them until they heal and basically their outcome is satisfactory where you can discharge them. Home care means that you can stay on for 60 days. That company can keep you on for 60 days. That means you get therapy for 60 days, you get nursing for 60 days, you get occupational therapy for 60 days. And after the 60 days is up, if you feel as though you're progressing and you still need more, they can do what they call a recertification and put you on for another 60 days. So it's unlimited what you can get when you're doing Medicare home care. If you're with an HMO, and I'm not knocking HMOs, but I'm not very pro to them either. Mm-hmm. I mean, the company will have to call. They might authorize 2 visits. And every time they have the 2 visits up, they have to get another authorization. And sometimes they won't authorize any more visits. So the chances are right, because everybody today is trying to save money. We at All County Healthcare, we're not trying to save money. We're trying to heal you so that you can have a better quality of life. That's the reason we sponsor this program. Thanks to David, who brings in the physicians. We're trying to let seniors know what's out there so that they can primarily have a better quality of life. And if any time you don't know, if somebody tries to sell you something different and you don't know what it is, please give me a call. Call my office at 954-717-7027. Salesmen will come out and try to sell you a Medicare Advantage plan. They'll tell you, oh, this is free, that's free. How do I know? Because my mom, when we first started this thing, my mom got on a Medicare Advantage plan. Well, there was no advantage until I found out what happened, and that's how I got into this business. My dad got sick, came down with dementia. We needed a home health aide. We hired a home health aide. I ended up acquiring, becoming the vice president of the company. I thought what a great service it was. And today we've progressed for 25 years. We've gone from a respite custodial care company. We also have that division, and we also have a Medicare company. And the Medicare Certified company, we're ACH certified, and we just got our survey, and I'm happy to say we passed our survey in flying colors.
Nice.
That's unbelievable, right?
Yeah.
And all the new changes that kept coming down the road with Medicare. So if you think you're going to need home care down the road, right? It's your choice. The doctor might say, see, sometimes the doctor knows somebody, or is a friend of somebody, the medical director of somebody, says, I have this home care agency I want to use. It's up to you. And sometimes you don't know, but it's your choice. And I'm going to tell you one thing. We're the only company right now in South Florida that can help stop the readmissions to hospitals for respiratory disorders such as COPD. We've invested in multiple home units that you get. The unit is in a hospital. A lot of times, COPD you're never going to cure. But we don't want you to keep going in the hospital every 15 or 20 days for respiratory. All County Healthcare is the only company, I say this seriously, it's the only company that's invested in what we call IPV units, interpulmonary percussive ventilation units. And if you think you have COPD, or you know you have COPD, or you have respiratory disorder, tell your doctor you want to go to All County Healthcare, and you want to try their IPV unit, right? And if you go to our website, David, give me our website.
Mm-hmm. It's allcountyhealthcare.com. Also, we've had a lot of Facebook live questions come in tonight, so that's just, all you do is on Facebook, you just type in All County Healthcare INC or facebook.com/All County Healthcare, and you can get all the shows there. If you ever need to go back and look at a show, you've archived all the shows on your site. So thank you for that.
Hospitals are calling us right now. They say to me, Lou, can you help us stop our readmission? Readmissions means a patient goes into the hospital. He's discharged. 15 days he's readmitted for the same problem, COPD or respiratory. That's becoming an amazing problem for the state of Florida. All over the country, the readmission rate, that means it's costing the government more and more money. It's costing hospitals more and more money. So if you're suffering from COPD, and you got a nebulizer, you tried all these other treatments, make sure, go to our website, look up our COPD, call us, right? Tell your doctor that if you qualify, that means one of the things you have to be is what they call homebound status. The nurse will make a determination, the doctor will make a determination for homebound status. Now listen, homebound status means that you can leave home with assistance. That means you can go to doctors, you go to the hairdresser, you go to church, you go to shopping. But you can't go out there and play mahjong every day or cards every day or be on the road every day. But if you're homebound, that doesn't mean you have to be bedridden. That means you basically have to leave home with assistance. Then you might be entitled to basically home care. Home care comes with your Medicare Part A. There's no charge to you, no out-of-pocket charge to you, no copay to you. It's basically it's a service that is provided you by Medicare. As you grow older, you're entitled to home care. Why do they want home care? Well, it's cheaper for them to have you at home than it would be in a hospital.
Isn't it correct the working force pay for the Medicare for our elders?
Well,
in a way, that's the way it's set up.
Medicare is taken out of your paycheck every single. Your Social Security, your paycheck.
Correct.
You're still paying for Medicare.
Oh, even at
even
that's
Social
right.
Security, you're still paying for Medicare.
Correct me.
So
Thank
why
you.
not use it? If you're paying for it, use it.
Yeah, if you got it.
And somebody's going to say, you don't have to pay for prescription drugs. You don't have to pay for this. You don't have to pay that. Well, as long as you're healthy, guess what? You don't even need insurance. Mm-hmm. But once you get unhealthy, what's your choice? And I have more people calling me, I thought my mother was on Medicare. Well, she switched. See, what happens from October to December, people change,
Open enrollment, I think
open
is what it's called.
And all the word. Now, if you look at TV, the Humanas of the world, and I'm going to say they're bad, the AvMeds of the world, the Uniteds of the world, they all come on TV and they say, join this, join that, join that. They spend millions and millions of dollars on TV. You don't see one ad for Medicare. Not one ad. Why is that? Because you're looking for one company is for profit, which is the HMOs, and another company is for nonprofit. Well, I'd rather be with somebody who's going to spend more money on my care than a company that's for profit, and they want to make their profit, spend less money in care, and worry how much they're going to make. So the answer is, if you have a problem and you're undecided what to do, or you don't know what your policy is, call me up. We have a gentleman by the name of Sandy Jacobson. Sandy would come out and see you and tell you if you're eligible to go on Medicare right now, and you need a supplement. I recommended Sandy, and I don't sell supplements, but Sandy Jacobson is an expert in it. He does a lot of
He's been on the show twice. We try to get him on every quarter.
And he tells, everybody he's been to, everybody says, what a wonderful man. He's honest. He's this, he's that. And Sandy will tell you what's the best program for you. So if you need help, you can call David at the station. You can call me at 954-717-7027. If you have any questions, you can call our office, talk to one of our case managers. Again, that's 954-717-7027. They'll explain it to you. If you want to get to me, just tell them I heard Mr. Biasi on the radio. Please, could you have him give me a call, and I'll get back to you the same day or the next day. I answer all my calls, right? So again, if you have COPD, or you have a family member that has COPD, or a respiratory ailment, please go to our website. It's becoming a major, major problem today. As you see the ad, you see the big elephant sitting on the man's chest. He has COPD. He can't breathe. His quality of life is fading. Guess what? Call us. Let's see if we get you a better quality of life as you grow older with the COPD. There's many, many commercials now on with COPD and respiratory disorders. Along with that, we do it all. We do the nursing. We do the PT for therapy, for occupational therapy, physical therapy. If you have hip surgery, knee surgery, cardiac problems, if you just basically, there's many, 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 many disciplines that you might have that you're not sure of that might require home care that we can help you with.
Now,
even medical management, even med management, if you have problems with your medication.
I just want to go back to COPD for a second. I did some recent research on COPD. It's the third largest killer in America, in the United States.
Besides cancer and heart.
Cancer and heart are first two, and then COPD, which stands for chronic obstructive pulmonary disease. Right. So it's when you
that affects your heart too.
Oh yeah. So start shutting down your whole system.
Right. So the fact is, if you have COPD, right, we made a major investment in helping seniors with this, and please. Try us. Call. You have nothing to lose. Try us. It's 954-717-7027. Go to our website.
allcountyhealthcare.com. And you can bring an IPV machine into the home that actually breaks up the congestion.
Congestion, right. If you get a lot of excretions that you can't get up, that's what we do.
Now, it's not only smokers are getting this. People with secondhand smoke can get COPD later in life. People who've worked in environmental, like sandblasters, worked in construction.
Well, you see a big ad, to see that big ad where people with the asbestos problem, right? Yeah, I mean, there's billions of dollars left for asbestos problems, right? Which might be a form of COPD. There's many ways that if you qualify for an IPV unit, let me tell you, you're going to experience a tremendous relief and recovery. That you're going to have some kind of normality. We've had people on oxygen. After our treatments, they got off oxygen. We've had people that don't want to, that just look forward to the treatments because they can feel better. They breathe better. Right? We had one couple, right? The husband was on oxygen. Middle of the summer, we gave him the treatments for 11 treatments. He got off his oxygen. He was 84 years old. He went in the pool. He swam, came back, made love to his wife. The wife called us, said, "Hey, I want to buy that machine."
That keeps you healthy.
How
quality
can you
of
beat
life.
that, right? It's a good quality of life. So you're still not too old, but at 84, right? If you have COPD and you can't go up and down the steps, this might be one of your solutions. We're not saying it work for everyone. We'll say good chances that it's going to improve your condition tremendously.
Lou, we have about 30 seconds. I'm going to be really quick with this. I want to call all pulmonologists in South Florida. Please come on this show. You and your doctor living a longer and healthier show. Tuesday, 6 to 7, or Friday, 5:36. I'll welcome you. Any organization. Check us out on allcountyhealthcare.com. Lou, thank you.
One other thing. Okay, do we have a second?
Yeah, you got 15.
Okay, 15 seconds. Listen, if you have a doctor that wants to come on the show, bring him on. Call David, we'll get him on. Thank you very much. Thank you.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.
The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.